Kimberly and I'm an accredited exercise physiologist. What is a prostatectomy? Prostatectomy is a surgery to remove the prostate after being diagnosed with prostate cancer. Up to 90% of men will experience some level of sexual dysfunction following primary therapy for prostate cancer. Management strategies for sexual dysfunction mainly involve medications, although we know that erectile function has many contributing factors, and these physiological and psychological effects are not counteracted by medications. Exercise has been established as an effective treatment for improving many of these factors and aiding the return of erectile function. From a urinary perspective, up to 40% of patients may experience prolonged incontinence after their radical prostatectomy. Pelvic floor muscle training is the first-line treatment used to restore pelvic floor and bladder function. Continence after surgery. It is important to note that all men will have some level of incontinence after their surgery. How severe and how long it takes to recover will depend on many different factors. The first being the pelvic floor activation. Learning to activate your pelvic floor correctly prior to surgery really speeds up the ability to strengthen it after surgery. So it's important you see a continence physio before your operation. Second is physical fitness. Some people that are more sedentary and inactive recover a lot slower than physically fit or active individuals. The type of surgery will be determined based on how much of the prostate has cancer and how severe the cancer is, and will be something that will be discussed with you with your surgeon. Because each person's outcomes after surgery in regards to their continence and sexual function will be different, it means that there's no one standard approach to your care, and it is completely and 100% individualized to you. So it is really important that you find an exercise physiologist or a continence physiotherapist prior to your surgery to get an individualized and appropriate program for you. The benefits of exercise prior to having your surgery. We all know the benefits of exercise on our cardiovascular health, our mental health, and reducing our risk of chronic diseases such as type 2 diabetes, heart disease, and many others. But exercise also plays a really important role prior to your surgery. It helps reduce your risk of surgical complications after surgery. It helps to improve your recovery of your sexual function and your continence after surgery. And it helps to reduce any deconditioning in that period of inactivity, which means that you can get back to your routine, work and day-to-day activities much quicker. We don't have very many limitations when it comes to exercising prior to surgery, other than any other pre-existing injuries or health conditions that might restrict your activity. If that's the case, it's really important just to go and see an exercise physiologist or a physiotherapist to get a tailored, specific program for you. Otherwise, the guidelines state that we should be participating in 150 minutes of moderate intensity physical activity 5 to 7 days of the week. This includes aerobic exercise or cardiovascular exercise, and this involves exercise that requires a lot more oxygen than when at rest. So you should be breathing heavily when doing any aerobic or cardiovascular exercise. This includes things like swimming, riding, running, and riding a bike, and should be done at a moderate intensity. A moderate intensity exercise is at a point where your heart rate is up, your breathing rate is up, and you should be working to maintain your pace. And the best way to test it is through the talk test. If you're able to comfortably communicate, you're not quite working hard enough. Your conversation should be interrupted by you catching your breath. We also need to include 2 to 3 days of resistance-based exercise. This focuses on applying a load to the muscle through an external force, and it can be through free weights, machine weights, TheraBands, and even your own body weight, and should be again done at a moderate intensity. This type of exercise is really important in helping to maintain your function, help to improve your muscle strength and your bone density after a period of inactivity after surgery. It's also important to remember that some exercise is better than none. So just get up, get moving, and do as much as you can before your surgery. And just make sure that you're not doing anything that may cause an injury before your operation. After your surgery, it is important to let your body to rest and recover. You have been through a major surgery and things need time to heal. So getting back to exercise too quickly or even work too quickly can sometimes cause more harm than good. When you return home from your surgery, it's really important to make sure that you reduce any periods of long sitting. Just get up and get moving at a really light intensity around the home. You can start off with 2, 5, 10 minutes as you feel comfortable. Make sure that whatever you're doing does not cause any pain or discomfort, and make sure that you don't do any heavy lifting. We usually recommend not lifting anything over 5 kilos or anything that's going to cause you to hold your breath or to strain. If you've done too much, you might start to feel lightheaded, dizzy, and a little bit nauseous. And if that's the case, you really need to stop and have a rest. It's really important to remember that everyone's going to recover at a different rate. So please be guided by your exercise physiologist, your continence physio, or even your surgeon for what you should and shouldn't be doing. But you should expect that around the first 6 weeks that you shouldn't be doing any heavy lifting, anything that's going to cause you to hold your breath or to strain, as this may cause some damage. We also recommend that you just do really light, shorter, more frequent walks throughout the day and gradually start to increase the duration as you feel comfortable. And you should start your pelvic floor exercises as per guided by your physiotherapist. 6 to 8 weeks, we usually start to include light resistance training, so incorporating some light weights, body weight exercises in conjunction with your pelvic floor exercises. Again, we do recommend that this should be guided by your continence physio and your exercise physiologist. We also recommend that you can get back to swimming at this point as long as you've had clearance from your surgeon. 8 to 12 weeks. This is when we can generally return to all of your normal activities, work and high impact sports and resistance training. It is important to slowly return to these activities as you may have deconditioned in this time and run the risk of having an injury. So please make sure that you progress yourself slowly or just be guided by an exercise physiologist or physiotherapist. We can start to return to things like cycling, although many men don't find it comfortable to get back on a bike until well after 12 weeks. Some things that I get asked a lot when going into surgery is, do I need to see a continence physiotherapist or an exercise physiologist before surgery? In the case of your prostate surgery, it is important that you attend both. The continence physiotherapist will provide you with pelvic floor activation exercises that will help you return your continence at a much quicker rate after your surgery. And the exercise physiologist will give you functional exercises that relate to your work or what you do in your day-to-day routine to make sure that you don't decondition and help your pelvic floor exercises work together. How long before my operation do I need? As little as 2 weeks, we can start to see some improvements in physical fitness, strength, so it's important just to get moving as much as you can in the short period of time that you have before your surgery. I have injuries and I can't exercise. In this case, I recommend you go and see a health professional. There's always something that you can be doing pre-operatively to help your outcomes after surgery.